Hello, my name is Al Ali. I'm a professor of plastic surgery at UT Southwestern in Dallas. Okay, so how does a consumer, know whether a surgeon is qualified, specifically a plastic surgeon is qualified to do the surgery that they're interested in? Unfortunately, anybody that has an MD after their name can open up an office and say, I'm a cosmetic or a plastic surgeon, and the public may not know the difference whether they're qualified or not. There's a few things that you can do as a consumer to determine that. First of all, you could just ask the doctor straight, are you board certified by the American Board of Plastic Surgery? That's a simple question. The answer is not always that simple because there are some boards that borrow from that terminology very closely, and they can sound legitimate, but they're not. So the very specific thing you should be asking for is, are you board certified by the American Board of Plastic Surgery? There are some boards out there that are like the American Board of Cosmetic Surgery. That's not the same. The Board of Plastic Surgery, that's not the same. So it's very specific terminology. The other thing that's important to realize is that plastic surgery is a pretty big field. So some people may be boarded by the American Board of Plastic Surgery, but they don't do your procedure or the one that you're interested in to any great extent. So the second question you should ask is, do you do a lot of this procedure that I'm going to do, whether it's a rhinoplasty, tummy tuck, or whatever it may be? You should delve a little bit into it with your surgeon, because if they say, well, I do a lot, what does that mean? Well, do you do one a year, or do you do one a month, or one a week? Some cases, in some procedures, you don't need to do 100 a year, but in some procedures you do. You have to kind of look it up based on your particular procedure that you're looking into. Last but not least, especially in the larger procedures that you do, a very large number of plastic surgeons operate out of their offices, meaning they have operating rooms in their offices. They're legitimate operating rooms, but the qualifications or the requirements for operating in your operating room in an office is very different than the qualifications that you must have in a hospital. So let's say you're going to have a tummy tuck. A lot of plastic surgeons who have operating rooms in their office, they usually have to have privileges in a major hospital to do that operation. In case something goes wrong, you're able to take that patient to the main hospital. If that surgeon happens to be maybe not a legitimate plastic surgeon, they can say they could do it in their office. But the question you should be asking as a patient is, do you have privileges to do that operation in a major hospital? Hospitals do make sure that you are qualified and you are board certified in the specialty that you claim to be. Whereas in your office, or if somebody has their office, that is never checked.